A stroke is a serious medical emergency. It happens when the blood supply to part of your brain is cut off. Imagine a traffic jam in your brain blocking important roads. This blockage prevents brain cells from getting the oxygen and nutrients they need to survive. Just like a car engine needs fuel, our brains need a constant flow of blood. When this flow is interrupted, brain cells can become damaged or even die. Time is critical in a stroke, as every minute counts. Prompt medical attention is vital to minimize brain damage and improve chances of recovery. Strokes are a leading cause of death and long-term disability worldwide. They can affect people of all ages, even children. However, the good news is that many strokes are preventable. By understanding the causes, warning signs, and treatment options, we can take steps to protect ourselves and our loved ones from this potentially devastating condition. The human brain is a complex organ, responsible for controlling everything we do. It's divided into different areas, each with its own specific function. A stroke can affect any part of the brain, leading to a wide range of symptoms depending on the location and severity of the damage. For example, a stroke affecting the left side of the brain, which controls language and speech, may cause difficulty speaking or understanding words. A stroke on the right side, responsible for spatial awareness and perception, might lead to problems with balance, coordination, or recognizing faces. The effects of a stroke can be temporary or permanent, depending on the extent of the damage. Some people experience mild symptoms that improve quickly, while others may have long-lasting disabilities requiring ongoing care and rehabilitation. Understanding the areas of the brain affected by stroke helps doctors determine the best course of treatment and predict potential challenges during recovery. Strokes occur when something disrupts the normal flow of blood to the brain. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes are more common and happen when a blood clot blocks an artery supplying blood to the brain. Think of it like a clogged pipe in your house. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding in or around the brain tissue. This is similar to a burst pipe, leaking blood and damaging surrounding areas. Several factors can increase your risk of stroke, including high blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of stroke. Lifestyle choices also play a significant role, as maintaining a healthy weight, exercising regularly, and eating a balanced diet can significantly reduce your chances of having a stroke. Recognizing the warning signs of a stroke and seeking immediate medical attention is crucial for improving outcomes. Remember the acronym FAST, which stands for face drooping, arm weakness, speech difficulties, and time to call emergency services. If you notice any of these symptoms, even if they come and go quickly, don't hesitate to call for help. Other warning signs include sudden numbness or weakness on one side of the body, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, dizziness, loss of balance, and severe headache with no known cause. Time is brain, meaning that every minute counts when it comes to stroke treatment. The sooner you receive medical attention, the better your chances of minimizing brain damage and maximizing recovery. During a stroke, the brain is deprived of oxygen and nutrients due to a disruption in blood flow. In an ischemic stroke, a blood clot forms, often in an artery already narrowed by plaque buildup. This clot acts like a dam, blocking blood flow to the brain tissue downstream. Without a steady supply of oxygen and glucose, brain cells begin to die within minutes. This can lead to permanent damage and loss of function in the affected areas. Hemorrhagic strokes, on the other hand, involve bleeding in or around the brain. This bleeding can put pressure on surrounding brain tissue, causing further damage. The blood itself can also be toxic to brain cells, leading to additional injury. Both types of stroke are serious medical emergencies requiring immediate attention. As mentioned earlier, there are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes, accounting for about 85% of all strokes, occur when a blood clot blocks an artery supplying blood to the brain. These clots can form in the brain itself or travel from another part of the body, such as the heart. Hemorrhagic strokes, making up the remaining 15%, happen when a weakened blood vessel in the brain ruptures and bleeds. This bleeding can occur within the brain tissue, known as intracerebral hemorrhage, or between the brain and the surrounding membranes, called subarachnoid hemorrhage. Both ischemic and hemorrhagic strokes are serious and require immediate medical attention. The type of stroke influences the treatment approach, as different medications and procedures are used depending on whether there's a blockage or bleeding in the brain. Diagnosing a stroke quickly is crucial for effective treatment. Doctors use various methods to determine if someone is having a stroke and to identify the type. A physical exam assesses symptoms like facial drooping, arm weakness, and speech difficulties. Imaging tests such as CT scans or MRI provide detailed pictures of the brain, revealing any blockages or bleeding. Other tests may include blood tests, electrocardiogram, and carotid ultrasound to assess blood flow and identify potential causes. Treatment for stroke depends on the type, severity, and location. For ischemic strokes, clot-busting medications may be given intravenously to dissolve the clot and restore blood flow. In some cases, a minimally invasive procedure called mechanical thrombectomy can be performed to remove the clot directly. Recovering from a stroke is a journey that varies greatly from person to person. The extent of recovery depends on factors like the stroke's severity, location, and the individual's overall health. Rehabilitation plays a crucial role in regaining lost abilities and adapting to any lasting effects. A team of healthcare professionals, including doctors, nurses, physical therapists, occupational therapists, and speech therapists, work together to create a personalized rehabilitation plan. This plan may involve exercises to improve strength, coordination, and balance, as well as therapies to address challenges with speech, swallowing, and daily living activities. Recovery from a stroke takes time, effort, and patience. It's essential to stay positive, follow medical advice, and participate actively in rehabilitation. Support from loved ones is also invaluable during this time. While strokes can happen to anyone, there are many things you can do to reduce your risk. Living a heart-healthy lifestyle is paramount. This includes maintaining a healthy weight, exercising regularly, eating a balanced diet low in saturated and trans fats, and not smoking. Managing underlying health conditions like high blood pressure, high cholesterol, and diabetes is crucial. Regular checkups with your doctor can help monitor these conditions and make necessary adjustments to your treatment plan. Remember that prevention is always better than cure. By making healthy choices and managing risk factors, you can significantly reduce your chances of experiencing a stroke. Strokes are serious medical emergencies that occur when blood flow to the brain is disrupted. Understanding the causes, warning signs, and treatment options is vital for protecting ourselves and our loved ones. Remember the acronym FAST for recognizing stroke symptoms and seek immediate medical attention if you or someone you know experiences them. While strokes can have lasting effects, many people make significant recoveries with proper medical care and rehabilitation. By adopting a heart-healthy lifestyle, managing risk factors, and staying informed, we can prioritize brain health and reduce the burden of stroke in our communities.